The United Nations estimates more than 100,000 people have died in Syria's 2 years of civil war, and U.S. officials say more than 1,400 were killed from the recent use of chemical weapons. Here with more on the human cost of the war and medical relief efforts underway are UC San Diego doctor and member of the Syrian American Medical Society, Alma Harb, and Tom Reifer, sociology professor at the University of San Diego and fellow at the Transnational Institute. Welcome.
Thank you.
Dr. Harb, you grew up in Syria, I understand, and you still have family there. What are they telling you about what the living conditions are right now?
Lack of food. There's no place safe to be at this point, and there's no access to good health care, or basic health care, in fact.
Okay. And you're a member of the San Diego Syrian American Medical Society and the Save Syrian Lives campaign. Tell us what that campaign is doing.
This campaign is a non-for-profit, non-political that aims to fund and rush medical supplies to the areas inside Syria and in the refugees camp for the millions of people that are suffering and lacking the essential of medical and health care.
So the 2 million refugees, but also you're setting up, I understand, clinics, mobile health clinics?
So SAMS, through the Safe Syrian Lives campaign, has built about 25 field hospitals, trained physicians to deal and treat innocent victims of this ongoing conflict, as well as we have to remember to train first responders for triage of patients of chemical assaults.
Okay.
As well.
Okay. And Professor Reifer, the World Health Organization says Syria's civil war is currently, and they say this, the worst ongoing humanitarian crisis on earth. Why are they saying that?
Well, it's an internationalized civil war. There's regional powers and great powers involved on all sides. The Saudis and Qatar have been funding the opposition, including a lot of sectarian forces. Iran and Hezbollah and Russia have been funding the Assad regime. And it's driven the whole situation to get worse, and it's become more and more brutal. So the outside powers are involved. The United States is involved. We can't say that we're not involved.
How are we involved?
Well, because Saudi and Qatar are our allies. Qatar alone, which is a nation of 2 million people, has poured over $3 billion in arms and money into the conflict. Not necessarily help the Syrian people for their own interest. So it's a war in which the great powers and regional powers are involved, and the people that are suffering are primarily the people of Syria. Obviously, what's been done up to this point has been escalating the violence, and we have to have an alternative solution that gives peace and justice and dignity to the Syrian people, because the crisis can engulf the whole region as it's starting to do, and even the world.
And we're going to come back to that as far as what we can do and why it's not happening. But Dr. Harb, I want to ask you first, what are the critical medical and healthcare issues as far as staffing, doctors? What is critical right now? What's happening as far as epidemiology?
Yeah, well, as you know, we have over half of the physicians in Syria have fled outside the country. We have over 93% of hospitals been damaged or totally destroyed. These hospitals that are remaining have no power to keep running, and we have the epidemics that are on the rise of tuberculosis, measles, and other diseases that are not contained at this point.
And I think you mentioned 100 births a day is the estimate of babies in the refugee camps.
And that have no access to vaccinations or baby formula.
Okay. And Professor Reifer, the political debate is wearing on. We're just about to hear from the president. But in the meantime, what do you think is keeping the U.S. and other countries for that matter, from engaging in basic humanitarian efforts, or are we?
I think the reality is that there's a lot of geopolitical calculations being involved by the players. And there's rightly a lot of cynicism for all the actors involved. In some ways, it's not that it's irrelevant, but the powers may be forced into pressing for a more peaceful solution because that's what the people of the world are demanding. And I think that we have to realize that ultimately the people are stronger than governments. And people have a lot of wisdom. We need to take that collective wisdom and work with the Syrian people to come up with a solution to what is the worst humanitarian and human rights catastrophe in the world.
And along with that, Dr. Harb, if San Diegans want to be involved, what can they do? You have some fundraising events going on this
We
weekend.
just launched Save Syrian Lives campaigns in San Diego. We have 2 planned charitable fundraiser events, one in Hillcrest this Saturday from 10 to 12 in Aladdin Cafe. There's another one next Thursday. We also would urge every single American to go online to the SAM's website and donate online, and as well as there's a texting to donate that can help as well.
Okay, and I want to let people know that they can find out those links and relief information on our website, kpbs.org. Thank you both so much.
Thank you.
Thank you.